Hello and welcome to the Healthcare Authority's First Steps Maternity Support Services MSS online screening tool training. This training will walk you through submitting the MSS pregnancy and post-pregnancy screening results in the required online system. Information on how to log in to the online site is not part of this training. That information has or can be shared with those who have been identified as your agency's First Steps MSS coordinator. Structured data capture, or SDC, is a secure way to capture structured data through an online system. By using SDC, MSS providers can enter the screening results data directly to Healthcare Authority via forms. The direct data entry into the online form replaces the MSS prenatal and post-pregnancy screening tools. Chrome browser works best when submitting the forms online. However, Microsoft Edge often works. Safari does not support the online form. After you have logged into the screening tool website, you will see a dashboard. Click on the middle icon that looks like a briefcase with a pencil. This icon is for programs. If you logged in with the correct link, you should see MSS Screening Tool. There may be a few agencies who will have other programs available to them, but the majority of MSS agencies will only have the MSS Screening Tool listed. Click on the MSS Screening Tool. The program overview screen includes a summary, a MSS Screening Tool help document that includes information about everything within the online tool, your organization's information, your organization's submissions, and the 10 newest submissions. The overview and submission information includes information specific to your organization only and does not include information about other MSS organizations. The information pulled is from everyone who uses the same work email domain that you use when signing in. After logging in and choosing the appropriate program, you will always want to choose the Submissions tab. From the Submissions tab, you can submit screening forms, and you can also search to see if there may already be an MSS screening submitted by someone within your organization. Before starting a screening, you will always want to do a search to ensure that the client does not already have an MSS screening completed for the current pregnancy or postpartum period. You can search by using your agency's chosen naming convention, such as medical record number or assigned agency number in the Search By Properties field, or the client's Provider 1 client ID that is 9 digits and ends in WA in the Search By Data Values field. If there is no screening, you will want to submit an initial screening for the client. If there is a previous screening, you will want to follow the steps outlined in the Copying a Screening portion of this training. Now we are going to talk about the steps on how to submit an initial screening. From the Submissions tab, you will want to click on Form in the upper right-hand corner. If by chance you do not see the Form button, it may be because you have clicked on the Maximize icon. If you do not see the Form button but see 4 arrows pointing at each other, click on the arrows as that is the Minimize icon, and you should then see the Form button. After clicking on Form, you will be able to create a submission. Enter in the anticipated MSS eligibility period in the From and To fields. To fields should be the end of the month in which the 60th day post-pregnancy occurs, based on the estimated or expected due date. This information does not affect the data being collected and does not have to be corrected if the end of the MSS eligibility period is different than what was originally submitted. After entering the dates, click Proceed. After you have hit Proceed, you will be taken to the Screening tool. Every screening will be labeled as ad hoc. You will need to change ad hoc to the naming convention that your agency has chosen. Click on the pencil icon, delete ad hoc, and enter the naming convention your agency has chosen. Some agencies have chosen to use medical record numbers, while others have chosen to use the client's Provider 1 ID. It is important to be consistent with the name format within your organization. Using the correct format and not leaving the submission name as ad hoc helps make searching for a prior submission easier. Next, you will choose the tool option of creating an initial screening. We will discuss the other tool options later in the training. Next, complete all fields with red asterisks. These fields must be completed before the screening can be saved and submitted. If entering the screening results online a couple of days after screening the client, Use the date the client was first screened in as the screen date. Enter in your name, or if you are a staff who is submitting the results online for someone else, the name of the person who completed the screening with the client, and include the role of behavioral health specialist, community health worker, registered dietitian, or registered nurse for the person whose name is in the completed by field. Choose the MSS agency you work for, and then the service location. Choose prenatal screening if the screening took place when the client was pregnant, or post-pregnancy screening if the pregnancy has ended. Next, you will complete the client's demographics, including their name, date of birth, provider one client ID, residential zip code, and their race or races. After completing the required fields, you will complete the screening. The risk factors on the online tool are the same risk factors as the MSS prenatal and post-pregnancy screening tools that were posted as PDFs on the Healthcare Authority's website. The topics include prenatal nutrition, medical, age at conception, tobacco/nicotine use, alcohol and substance use, intimate partner violence, mental health, developmental disability, and on the post-pregnancy screening, child protective services, risks related to delivery, and risks related to the newborn. And those risks that included an asterisk requiring a licensed or credentialed MSS team member to make the determination on the previous tools are now grayed out when the tool is completed by a community health worker. These same risks are still require a behavioral health specialist, dietitian, or nurse to make the determination if the client meets the criteria for that specific risk. After completing the screening, the screener can check the box to acknowledge all risks have been screened for, or leave it blank if a full screening did not take place during that visit. Even if you have not completed a full screening, you will still want to save and submit the screening. Clients can have multiple screenings submitted. Below the acknowledgement box, the risk response and the A, B, and C risks will auto-populate based on what risks were marked within the tool. After completing a screening to the best of your ability, click Save and Submit. If you only choose Save and another MSS team member searches for a screening, the screening you have done will not appear. You will always need to hit Save and Submit, even if you plan to go in at a later time to complete the online screening. It is okay if a client has multiple screenings. Once you have hit Save and Submit, you will need to save or print the screening tool so that it can be uploaded into the client's MSS chart. From the summary view, click on Preview. After clicking on Preview, you will be taken to the print screen. Under Printer, you can choose to save the screening as a PDF in order to upload it into the client's file, or choose to send it to a printer to print the screening and then scan into the client's file. Each screening must be uploaded or scanned into the client's electronic health record or chart notes. Once you have printed or saved the screening results, click on Close, and then click Close again on the preview screen. You have now submitted an initial screening into the online system, and the Healthcare Authority will be able to see the data you have submitted. Now that you have submitted their screening form, how can you be sure it went through correctly? You will now be able to see the status of your submission. Make sure you are in the Submissions tab, and below you will see the name you gave the screening, and status will be Submitted, which will change to Processed within a couple of minutes. If you do not see that the submission has been processed after 10 minutes, please reach out to your supervisor so that they can reach out to the Healthcare Authority. You will also receive an email when you submit the form, and another when the submission has gone through validation. If you do not want the emails to go into your inbox, you can set up a rule within your email to have the emails go directly into a folder and not your inbox. When submitting screenings, it is very important to make sure that you are choosing the correct tool option. The following slides provides detail on each of the different tool options available in the screening tool. Creating an initial assessment is used when you are starting a new screening for a client. This would include the very first time seeing a MSS client, or if you are seeing a previous client who has a new pregnancy. Completing a clinician review questions should be chosen when a community health worker has started a screening and a licensed or credentialed MSS team member is going in to make the final determination on those risks that a community health worker cannot choose. Replace screening with a new screening is used when you are copying an existing record to update the screening tool to add additional risk factors that were identified after the initial or subsequent screenings took place. Choose moving to post-pregnancy when you are copying a screening that was completed during the pregnancy and the client's pregnancy has now ended. Please note, there are questions on the post-pregnancy tool that are different than the prenatal tool, and these risks will not carry over from the prenatal tool. It is important to go through the entire screening tool to ensure all risks are marked. Correcting or updating demographic information only is used when you need to correct any demographic information. This must be done in a separate submission from any other correction and does not replace any other data. If you need to make demographic changes and additional changes to the tool, complete only the demographic information and save and submit, and then copy that version of the tool and make the additional changes. If you made an error on an existing record, that is not related to demographic information, such as inputting an incorrect date, choose the correcting an error on an existing record and make your change. If you marked a risk that should not have been marked, use this tool option. Removing a prior record should be marked only when the record should be removed, such as entering in information on the wrong client or you received an email from the healthcare authority asking you to do so. Please note, this does not remove the screening from the list of submissions, and we ask that you add removed to the end of the screening name so that others within your agency do not copy that screening. Now we will walk through the steps of copying a previous screening. Examples of when you will need to copy a previous screening are to complete a clinician review questions from a screening submitted previously, correct or remove something from a prior screening, update the client's demographic information, add more information to a prior screening, indicate a mistake was made and the prior screening should be deleted, and move a client to post-pregnancy. We do not expect you to go into the screening tool every time you have a MSS visit with a client. The times you will need to go into the tool are when you are a clinician who needs to review the risk factors that a community health worker cannot make a determination on, or moving a client from prenatal to post-pregnancy, or updating new risks. Copy function. Copy is when you are using a prior screening to correct or create an updated screening. You will use this feature frequently. Copying a prior screening is used to save time, eliminate accidental typos, update a prior screening that contains an error, and to add or update information on a previous screening. So examples, you created a screening last week and now you want to update it with new risk factors that have been identified. A community health worker started the screening and you are a clinician who needs to complete the clinician review questions on the screening. Or you need to add new information, but you don't want to type all that demographic information in again. There is one exception when the copy function does not copy over everything, and that is when you are moving a client from prenatal to post-pregnancy. The copy function will only copy questions that are exactly the same in both forms. If you're using the copy function to move from prenatal to post-pregnancy, there are some responses that are different in the post-pregnancy form, and they will not copy over. These include the topics of prenatal care, pre-pregnancy BMI, late-term pregnancy loss, multiples, diabetes, hypertension, client age, tobacco nicotine use, and alcohol and substance use. The post-pregnancy tool also includes the post-pregnancy only questions that are related to the infant and delivery. Be sure to review all questions in the screening. When copying a screening, you need to use the most recent version of the screening. This ensures that you are using the form that includes all information submitted on previous screenings. If you choose the initial form and someone else has made changes to that form, those changes will not be included in your newly updated form. You can also confirm that the form you are choosing is the most updated by looking at the modified on date. Click on the hyperlink of the most recent form version. If a screening name ends with removed, do not choose this screening. Next, you will click on Copy to copy over the MSS screening tool. This slide is very important. When you are copying over a screening, you need to make sure that you select the Select All Fields button to copy over everything that was in the previous screening, and then deselect Tool option screen date, completed by, and role/title. It is very important that you deselect these fields, especially the tool option. If you copy and select all and do not deselect the tool option, the original option sticks in the form. Even if you change the tool option in the copy, it still holds on to the original value behind the scenes and does not set the correct current option for the screening. This will cause duplicate screenings, and the healthcare authority will reach out to a supervisor to have the screening corrected. After selecting all fields and deselecting the tool option, screen date, completed by, and role/title, click Next. Make sure the Keep in Current Form button is selected and click Save. If you click Save and an error message of copy submission is allowed only in published forms pops up, you will need to click on Move to another form and choose the MSS Screening Tool option under Maternal Screening, and then click Save. This error message will occur when the healthcare authority has made changes to the screening tool and should not happen very often. From the Submissions page, you will see a copy of the previous record. The name of the record you copied will end with _copy. Click on this hyperlink. After clicking on the hyperlink, you will need to update the screening name by clicking on the pencil icon. Remove copy and update the name to allow others to know it is a new version based on your agency's naming convention. After renaming the screening, click Save. Next, you will need to choose the reason you have copied a prior screening. In the tool option, think, what are you doing today? You're now doing something that's different than you were doing when you created the original version. So choose the tool option that best fits as to what you need to do within this current screening tool. And remember to complete the rest of the screening and see if anything else needs updating. Choose the appropriate tool option, enter in the updated screen date, completed by, and role/title fields, and make your updates or changes. Once you have completed your changes to the screening, click Save and Submit. Same as the slide in the initial screening portion of this training, you will need to save or print the screening tool so that it can be uploaded into the client's MSS chart. From the summary view, click on Preview. After clicking on Preview, you will be taken to the print screen. Under Printer, you can choose to save the screening as a PDF in order to upload it into the client's file, or choose to send it to a printer to print the screening and then scan into the client's file. Each screening must be uploaded or scanned into the client's electronic health record or chart note. We have now completed the steps on how to submit the MSS screening into the online system. Additional materials and desk aids will be posted to healthcare authorities' First Steps MSS and ICM provider website. Many of the MSS coordinators and supervisors have received additional training on submitting the MSS screenings and may be able to help with any questions you may have. You can also reach out to me, Heather Wire, MSS Program Manager, at hcafirststeps@hca.wa.gov. Thank you.